Hi, I'm Kathryn Tout from Child Trends, and I am going to talk about just a general picture of what we know about quality improvement supports in QRIS. And I think the subtitle could be Reality Check. That would be a good subtitle for this. And I was realizing as I was looking over some of my slides, there's some understatements in here, so see if you can find them as we go. I want to talk a little bit, the four things I'll talk about are just to give you a flavor of how the provision of quality improvement supports is varying across states and within QRIS. Also, to talk about how QRIS quality supports really does have some unique features. Some of those are problematic, and some of those I think are opportunities for us. I think maybe this is the understatement. QRIS supports in QRIS could be more tightly aligned with research-based best practices in coaching and PD. And then the fourth point is to bring about stronger support for children's development, we may need to look at quality standards and the QRIS, a review and revision of those. So I'll return to each of these. I just wanted to give you a preview. And here are the sources. I didn't put them on the individual slides. I pulled these points together based on a variety of resources. Many of them have Marty's name on them. Someone asked, did you include Marty? I said, of course. I have, I think, 5 bullets with her name on them. But much of it is some of the QRIS work we've done together, looking at literature on coaching in QRIS. We did a case study that included Miami-Dade, and you'll hear a little bit of findings from that study. We also drew heavily on I drew heavily on the compendium, also on Sheila Smith's work in the National Center for Children in Poverty. She's been looking at coaching and quality improvement supports and reviewing standards. So just a variety of sources, although there is so much more that we need to know about this topic. So the first one, and it's not a continued slide, I moved these around and forgot to take the continued off that top, but the first is that we really do see a lot of variation in what quality improvement supports, especially on-site technical assistance, what that looks like in states, within states, and across states. So when we ask what is the goal of on-site technical assistance in QRIS, usually it's about, as Noreen said, it was a perfect example of improving quality broadly, and of course improving quality as it relates to the rating system, but it's not targeting a particular content area. It doesn't target a particular skill set or a curriculum. So it really is this broad approach to improving quality. And when we ask different states what are the different types or how is the TA provided, it's usually around these 3 areas. It's either help preparing for the rating, facilitating the rating process, or improving the rating. So it really is all about the rating. When we ask about the content of visits, and as Noreen said, it's very hard because a number of the TA systems don't collect that information, but I do think that's changing, so that's something that we can look forward to in the future, learning more about it. But for the most part, the visits and the content is really focused on 2 things. And there are other things, but these are the 2 main things. One is support in navigating the QRIS. So a number of visits may be focused on compiling paperwork, getting documentation together for that rating, helping understand what the indicators are and what evidence is needed for each of the indicators. So much of this is really spent on navigation of the QRIS. And then the other piece is the environment rating scales. I said environmental assessments, but usually it is the environment rating scales. And so a good portion of technical assistance in QRIS is focused on that observation and preparing for it. Many of the QRIS report, again, as I mentioned, that it's really aimed at those specific components of the rating scale that will help a program move up. So that is how the quality improvement plan is set up, and that's how the QRIS technical assistance is aimed at, really helping move up the rating scale. So we do know a little bit about how dosage and frequency looks, and this is where the word variation is really important. When we ask states in the compendium, gathering data for the compendium, what dosage or what frequency these visits happen, many of the states said it absolutely depends on the provider. They didn't even have a range for us. They said it depends on the needs of that particular provider. And I think I did put it on my slide, but I do think in some ways this is potentially an opportunity for QRIS quality improvement system, but it means that we have wide variation. We do know in about 60% of the QRIS that Sheila Smith recently interviewed, they provide 10 or fewer visits to centers and homes. However, others provide more like 10 to 20 visits, and I don't know, Noreen, how the hours you mentioned, how that was, but you had said about 6 hours a month, I think it came to. And in most QRIS, the visits do occur monthly, although some do have more frequent visits. In some QRIS, there is, as I said, there is no limit to the number of visits provided. It may be over a number of months. It may be over a number of years. And the other thing I think that's really important about QRIS supports, when we talked to within states doing some of the case study work, is that they mentioned that many of these programs are receiving other on-site technical assistance. It might be through accreditation facilitation, positive behavior support, mental health consultation, and for some of these programs, that is not coordinated at all with the QRIS. Beth mentioned an example in Kentucky where their new system is helping to provide some of that coordination, but for many programs, they will say, we don't even know who's coming in today. It could be someone's coming and I don't know what she's here to do because we've got so many people coming into our program, and this is a small slice. I am not saying this is most programs in the United States get this level of multiple providers. I think it's an interesting reflection of the programs that seek out assistance tend to be those that seek it out from wherever they can find it. And so we have some programs receiving many different visits, some receiving absolutely none at all. But this is an important opportunity, but also probably some duplication and mixed messages being provided to programs in the QRIS. So a little bit more about what I think some of the unique features are, and we've talked about some of these already. But on-site coaching and TA and QRIS is usually aimed at the program level, and that's different from some of the, not all of them, we heard about some of the supports yesterday that are provided at a program level, but I think it is more rare to have consultation or coaching provided at the program level where it may be the director who is the initial target of the quality improvement supports, but then it goes to the teacher level, or in a family child care provider, they might work with the assistants. So it is a different model from some of the typical coaching you see in the literature where it's very classroom focused, very lead teacher focused. This is aimed across the program, and then just by extension, it is more diffused and probably less intense because of that in some ways. There's also, as I mentioned, the provision of TA or coaching is of longer duration than what we see in other coaching in the literature. And in some cases, it may be indefinite. So this does, and as Noreen just had the perfect segue for this because she said that duration was related to their scores. It provides an opportunity to focus on long-term goals and develop the capacity for continuous quality improvement. And in fact, in some of the QRIS models, that really is the focus on working with the director to become that change agent for the program, which I think, again, that is a major opportunity for us to learn more about that process and about what sustaining quality can look like in programs when the program itself has the capacity to look at their own quality improvement over time. And then just a big one, I'm sure Rena will talk about this more, but I think it's so important to remember that in QRIS, the coaching is happening as part of a larger system that's evolving. And the quality standards and tools are sometimes revised in the middle of the process, in the middle of working with a program. So they're in a system that's shifting sometimes. And then Noreen gave the example in Miami of 3 agencies overseeing that consultation. In many states, there are multiple contractors and organizations are involved. And when we talk to the coaches or the consultants from those organizations, they feel that this is problematic because sometimes they came from a different maybe a different coaching model, or they had been doing something else, and you see discrepancies in the way they implement the coaching, and in the way that they are doing their work in general, which creates some unevenness in the system. And it also is just an implementation problem when you have multiple contractors and organizations doing different things. So again, some challenges and opportunities in QRIS. So our understatement of the QRIS could be more tightly aligned with research-based best practices in coaching and PD. So this is some of Sheila's work. Sheila Smith's work has been really helpful here, and we saw some of this as well in our case studies. The one of the pieces of QRIS coaching that's different from coaching that you read about in the literature is that it's much less likely, and in fact almost never, from our read of it, that it's almost never linked with other professional development, such as training or coursework or communities of practice. So whereas the coaching that we know can be effective is often linked with some other knowledge component, as Marty was mentioning, because this is a more general focus on quality, overall quality, it's not usually linked with some other training or knowledge component. The exception is that there often is an orientation. Some QRIS will have an orientation or some class that will be on the environment rating scales, and so that's one linked piece. But usually you don't have the coursework linking to any other professional development. Another thing that's different is that the coaching really doesn't focus on the specific practices to support children's development, unlike the coaching that is in the literature. So you find that programs, the coaching is really focused more on some of those environmental indicators, really, again, focused on the environment rating scales, but it doesn't tend to be on specific approaches or specific practices to support language and literacy or math or social emotional development. And in fact, another piece that we've learned about how coaches do their work, they are very infrequently using some of the practices that we know to be effective. So they're not using modeling or feedback loops. It's very much, they may do an observation of the teacher's practice, but they're not using some of those research-based practices in coaching that we know can be more effective. So on both the practices that they focus on and on the methods that they're using, at least in the coaching programs that we've looked at, we don't see it aligning with what we know to be working in the literature. We also have heard in talking with on-site coaching staff that they perceive a lot of freedom and flexibility to interpret and adapt the coaching model. And I think part of that is related to the implementation of having multiple contractors in doing QRIS coaching, but this really creates an issue for fidelity and for understanding what is actually being implemented in these QRIS when we have coaches who perceive a lot of freedom. And again, this may be an opportunity for us, but I do think it creates an issue for fidelity that we need to focus on. So just a few implications and challenges. We need so much more work to identify effective models of TA and coaching in QRIS that can work in this scaled up real world environment. And I know we spent a lot of time talking about that yesterday. We also really need to think about implementation, the training of the coaches, how we're going to monitor fidelity, supervision, and especially data systems so that we have the information that we need to know what's going on in coaching and QRIS. We also need to think, as I mentioned, about coordinating and aligning with other quality improvement efforts, especially as we think cross-sector and begin thinking about how we can leverage supports across childcare and pre-K and Head Start and early Head Start, and beginning to align and coordinate those better so we don't have duplication. And then finally, developing a process to revise the standards and develop appropriate measurement and quality improvement approaches that can align with those standards. So thank you.